Hello, I am Suchita. My topic today is the healthy city. I have two cities to discuss, which is Phnom Penh City in Cambodia and Chicago in USA. First, I'm going to talk about the overview of healthy city. Then Phnom Penh toward a healthy city, which cover the policy in Phnom Penh, COVID-19, and examine the issue. The model city that I chose is Chicago and its policy plan for healthy city. Finally, I'm going to cover the deploys of these two cities and the 3 year strategy plan for Phnom Penh city. To go deeper to the topic issues, we need to understand the term of healthy city. Healthy cities is a people-centric concept that refers to the policy or activities to make sure that the resident people's status is sustainable in terms of physical and mental well-being and the quality of life. Healthy cities is a continued approach to ensure that people and environmental are balanced. It aims to create a health supportive environment, achieve a good quality of life, provide basic sanitation and hygiene needs, and supply access to the healthcare. To determine the healthy city, we need to look into the environmental system that contain natural ecosystem and public facility that include the green space, water supply, public service, and so on. Another one is social economic system, which has the urban planning policy, finance city programs, so on so far, and the human behavior that include the life expectancy, physical, mental health, and so on. Here come to Phnom Penh toward a healthy city. The government has established Phnom Penh City Plan that starts from 2018 to 2030. It aims to bring the city to a clean, green, safe, and a quality lifestyle to the residents. Priority sector for the program is as seen in the picture. Let's start from the urban planning to the public space and the cultural heritage. This program is accompanied by Green City Strategy Plans methodology, which has 10 steps starting from established planning to implementation. Surprisingly, there come a COVID-19 pandemic to the city. To understand more about the pandemic and the city's situation, I conduct a survey to 60 resident people. Uh, Almost half of the residents have choose the average for the question of how well Phnom Penh is a livable and well-being city, while 20 and 80 choose poor for the both question. Come to the current situation, to the equal number of 27 choose healthy facility and the environmental as the most concerned problem uh, in the Phnom Penh city. The image of COVID-19 case may change to the urban as well. 55% said that the way of health sanitary in the city has changed, while 27 said that the pandemic brings new lifestyles to the city. The survey also includes the residential people perspective in terms of healthy city as well. The survey showed that people prefer city with no pollution, green space, good healthcare, and a happy lifestyle. Uh, well, the priority data from the planning with the primary data from the planning policy and the second data from the survey, I summarize this topic using the SWOT technique. As for strength, for this policy, it is focused on the important sectors such as the improvement of lifestyle quality and put much concern on the environmental and pollution, which are the more source which are the core source for the healthy city and also answer to the current issue from the survey as well. Moreover, this plan has clear outline, detailed analysis, and a time frame. Weakness of this policy is it is less focused on the mental health of people and not mention about the medical facility. And the opportunity is that we can study from the COVID-19 case and and improve and define the leakage of the policy. And if the plan is success, Phnom Penh City will become a healthy city with reduction of poverty rate and increase the economic opportunity in 2030. The last one is the T for treat toward this policy. We cannot guarantee that the resident people will participate the assessment or the action of this program. Moreover, change of behavioral and lifestyle during the pandemic period led to the difficulty to the policymakers. Now, let's learn from the Healthy Chicago. Chicago has a program called Healthy Chicago 2.0 that starts from 2016 and finishes in 2020. The version of Healthy Chicago 2.0 is to strengthen the community and collaborative stakeholders, and residents enjoy access to the resource, opportunities, and the environment to the maximum health and well-being. This program focuses on 30 goals, 82 objectives, over 200 strategies across 10 action areas and 75 indicators benchmarked to meet the 2020 target. Assessment of this program is the analysis of community feedback, trends that impact on the health system, community health data, and the capacity of health system. Uh, This program was built through direct community engagement and the prioritized area, which are the root cause of urban health and the outcome are for the community that face greatest challenge in the five priorities, such as the promoting behavioral health, strengthening child and adolescent health, preventing and controlling chronic disease, preventing infection disease, and the reduce violence. The map in red mark are the place that are the map in red mark are the place that face the challenge in urban health. Limitation of this program is lack of clarified arrangement to support the implementations and the coordinations, many objectives and the strategies, and as well as no prevention strategy to some fundamental change in the city. After accomplish the first program, Chicago published another program called Healthy Chicago 2025. The vision is to make a city where all people and all community have power free from oppression and equitable access to the resource, environmental, and opportunity. This program is continued tracking on Healthy Chicago 2.0 indicators and create dashboard for implementation and evaluation. Assessment is to analysis of community feedback, trend that impact on health system within the next 5 years, and the community health data and capacity and function of the health system. Healthy Chicago 2020 Healthy Chicago 2020 is a continuous program from Healthy Chicago 2.0 and focus on the priority areas such as housing, food access, health service, and environmental, and so on. The theme of this new program is to strengthen community capacity and leadership, improve system of the care for population and most affected by the inequality, further the health and vibrancy of neighborhood, transform policy and process to foster an anti-racist. Meanwhile, the COVID-19 pandemic came unexpectedly. Therefore, Healthy Chicago 25 is applying the lesson of COVID-19 to change how city work and who work for what. Because of the policy and system somehow disadvantage for the Black and Latin Chicagorean. Therefore, they were more likely to catch the COVID-19 and die from the pandemic than the white Chicagorean. As seen in the graph, the highest case of pandemic is the Latin. As a result, city put critical measures in the place like eviction protection, small business, grants, and emergency food distribution system. As a result, another program called Live Healthy Chicago or COVID-19 project has been conducted. It is a community-based collaborative project comprised of 28 organizations to address the COVID-19 through education, prevention, and supportive service. The mission is to address and improve the immediate wellness of the seniors and high-risk population in target communities. Its services are to provide food security, PPE, and wellness calls. Learning from the success healthy city of Chicago, I have come up with a 3-year strategy healthy plan for Phnom Penh City. The goal is to improve lifestyle quality by prioritizing on people's health and their well-being, the green environment The key objective of this plan is to improve the health service accessibility, increase green space and park, promote behavioral life expectancy. Collaboration with the community and stakeholder is needed to implement the plan. And the key indicator, uh, and the key indicator, and the key indicator to evaluate the plan is assembling of stock stakeholders and local people to investigate and indicate the gaps and the progress of the program. The stakeholder that involved in this plan include the municipal partnership and the resident people. To achieve this plan within 3 years, first we have to come up with the plan, then review the key sector. After that, we can establish the plan to the public. The pro the progress of the plan can be investigated by stakeholders and local people. And finally, evaluation is done to implement the 3 year healthy plan for Phnom Penh City. And here is the reference, and here's the reference for my presentation. Thank you.